Visibility in the national capital is so low, it feels like our politicians cannot even see the obvious. Delhiites are developing health conditions seen in lifelong smokers. Children are struggling to breathe. Hospitals are stretched. Doctors warn of permanent lung damage, also permanent damage to your life. But inside Parliament, the response will baffle you. In a Rajya Sabha, in fact, a reply was filed. Minister of State for Environment Kirti Vardhan Singh said that based on the available data, a direct link between air quality levels and lung diseases has not been firmly established. He's saying there is no link between air pollution and lung disease. Let that sink in for a while. This is our Minister of State for Environment, Kirti Vardhan Singh. While doctors speak of shrinking lungs, fibrosis, irreversible damage, while health experts urge residents to leave Delhi NCR if they can, government says science is not conclusive. So let's be clear about what the world's most credible medical research is already telling us. A report by Lancet says Lancet of course, one of the most respected health journals in the planet, in the world really, shows that in 2023, more than 1.5 million people in India died from exposure to fine particulate matter, meaning PM 2.5, making this one of the biggest killers in the country today. Science could not be clearer. Prolonged exposure to polluted air scars the lungs. Fine particulate matter, PM 2.5, PM1 as well, penetrates deep into the lungs and bloodstream, triggering chronic inflammation. That inflammation leads to asthma, COPD, fibrosis, heart disease, premature deaths. The list is very, very long. Children are growing up in polluted cities. Those who do show stunted lung growth. Adults are losing lung capacity in many cases by half. And once lung tissues harden, it never regenerates. It's not one of those organs. This is not speculation. This is not theory. This is what the evidence, the doctors say every day. So when the government is asked what to do to protect people, the answer is not emergency action. It is awareness booklets, training programs and advisories. But alerts to not repair lungs, remember, forecasts to not reverse fibrosis. And clean cooking fuel does nothing when the air outside is poison. Refusing to acknowledge a direct link is not science. It is delay, distraction. It is denial. And that's the worry. There is no lack of data, as we know. There is perhaps lack of a political will to admit the scale of this crisis and do something about it. That's why the question in front of us is pretty deadly, pretty simple. How many more will have to die before our leaders stop treating it like an inconvenience that we've started treating air pollution as, just another inconvenience that India lives with? What exactly is happening? If you don't believe us, listen in from the top doctors in the country. Joining me next is Dr. Arvind Kumar. He's a leading pulmonologist. He opens people's lungs. He does surgeries. He also deals with lung cancer almost on a daily basis. So he really knows what's going inside. So Dr. Arvind Kumar, I want to understand from you. The Parliament reply is beyond me. What do you, as one of the best pulmonologists in the country, feel about this reply from the government?
Yeah, first of all, thank you very much for having me on the show. Secondly, I would not like to comment on what has been stated in the Parliament. That's probably out of my purview. But as a doctor, as a chest surgeon who operates on chest every day and gets a chance to see 3 to 4 lungs every day for the last 30 years and has seen a sea change in the color of the lungs of the people, which is a direct impact of air pollution. I would like to say that air pollution is playing havoc with the health of the people. I'll send you the images. Normally, when we are born, we have pristine pink lungs, which I rarely see these days. Even teenagers, when we operate, we find black deposits on their lungs, and this is the image that you can see. There are black deposits on the lungs of a teenager, and this is the image of the lung of a non-smoker from the city of Delhi. And you can see there is hardly any normal area left in the lungs. I am also a lung cancer surgeon, and I have seen the lung cancer, which used to be a smoker's disease 25, 30 years back, happening as much in non-smokers as in smokers today, number one. And what used to be a male predominant disease 30 years back is occurring today in male as well as female, especially non-smoking female, and is occurring about 15 to 20 years younger age than what it used to happen. So when and you ask any doctor, any pediatrician, they will tell you that these days, with these kind of air pollution levels, our OPDs, our emergencies, our wards, our ICUs are flooded with people, not only chest diseases. People think that this air pollution only causes lung diseases. Yes, lung diseases are in majority, but it also causes heart attacks, it also causes brain attacks, and it causes whole lot of other diseases also, including diabetes and obesity. There is data to prove that each of these diseases is linked to air pollution. So this is what I would like to submit as a doctor who's seeing all these diseases in his clinic regularly.
Oh, Dr. Kumar, that's a reality we've known for a while. We really hope these words, the reality you face every day, actually reaches the government as well. But let me ask you this, year on year, air pollution is not a problem that has suddenly come on us, right? It's been in the making for the past 10, 20 years. Year on year, are you seeing any change in your patients' bodies on what sort of this extended periods of exposure to polluted air is doing to us?
So we have increase in the number of patients, number one. So year on year, if you see, you will find more and more patients coming in. There is a change in the demography of some of the diseases. For example, as I said, lung cancer was virtually unknown in non-smokers, and today it is occurring as much in smokers as in non-smokers. This is a massive change, which is a cause for worry, because if you smoke, or earlier we used to say, well, if you want to, avoid lung cancer, don't smoke. But today the message will be, if you want to avoid lung cancer, stop breathing. So there is a huge change in the demography of Syria. Likewise, COPD is a disease where the lungs become kind of swollen, and they become filled with air. This is a disease which was again known as smoker's disease earlier. But these days we are seeing increasing number of non-smokers, especially women, coming with COPD. So we recently carried out a study of the lung functions and lung symptoms of about 4,000 children across 22 schools in Delhi NCR, and were horrified to find nearly 60% of the children in the age group 11 to 14 years to be reporting respiratory symptoms like persistent cough, sneezing, running nose, chest pain, chest tightness, itching in the eyes, etc., etc. Can you believe it? 60% of the children reported these symptoms to be present, and 27% of the children were found to be spirometry proved asthma. 1/3 of children were having spirometry proved asthma, though most of them were not aware and were not on treatment. So there is a huge amount of disease, disability, and even premature deaths which are occurring out there, which all of us doctors, not me alone, all of us doctors are seeing it every day in our clinics, in our wards, in our emergency rooms.